Hello, everyone. I'm Lico, and I'm here with Dr. Mehta at Nemours Children's Specialty Care. And we're here to talk about some of the things that Nemours has been doing. You all have this beautiful new location.
Yes.
And we're going to talk about you also and your experience and just everything that's kind of led up to this part in your career and kind of your life mission. Let's go ahead and start with you.
Okay.
And tell us about your journey to being where you are now with Nemours.
Right. So I am a pediatric cardiologist by training. So I love taking care of children that have complex heart problems. My area of expertise is prenatal diagnosis, so fetal echocardiography and diagnosis and helping the parents plan for having a child that has congenital heart disease. And I was in South Florida and I wanted to come to a smaller community, but still be able to practice pediatric cardiology. And so that's what drove me to Nemours and to Pensacola. And so I've been here for 15 years, and I was also able to grow from the administrative standpoint into my position now, which helps me lead this entire group of incredible doctors into taking care of more patients, more children across the Panhandle through our partnerships.
So you talked about 15 years is how long you've been here. In total, how long have you been in the medical industry?
I have now been almost 28 years doing pediatric cardiology after my fellowship, which was done in Miami, and I practiced in Fort Lauderdale for several years before moving up to the Panhandle of Florida.
Well, definitely glad that you came up here, and
Me too.
Pensacola is such an amazing place, and it's beautiful up here. When you started with Nemours, what was the journey like from there to where we are now? Because 15 years, a lot can happen in 15 years, and you have seen the growth and the changes and the developments, the advancements in technology and everything.
Yes. So when I came, Nemours was a little smaller here, and so we've grown in both our subspecialties and physicians and their specialties within a section. Like in cardiology, I practice the fetal part. We have a sports cardiologist, and we have a generalist that does all the different parameters that we take care of. And it's the same with each of the other specialties. We've also advanced in our technology so that we can be here and yet helping take care of a patient many miles away, like in Panama City or Fort Walton. And that helps the families that are not able to travel as much to find our expertise, but we can help them through the telemedicine programs and for our expertise through that.
Now, I'd really like to focus a little bit more on this telemedicine program. What does that actually entail? We're using some sort of technology to do this. How does that work?
Yes. So telemedicine has multiple components of it. So we read echocardiography studies for, say, a baby in the newborn nursery that the neonatologist or pediatrician may be concerned about. So the technician at that hospital, maybe 200 miles away, can perform that study, and through the internet or the cloud is able to send that information to us for us to look at in almost the same way that I would do if it was being done right down the hallway. And then I can advise the pediatrician or the neonatologist what to do. What's the best thing for that child? Maybe they don't need to transfer by helicopter or a plane, or to make sure they get to the right place the first time. Unnecessary transports is how we're saving the community money and helping the family stay close at a time where maybe the mom won't be able to travel with the baby, or family members need other support in order to make that happen.
That's truly amazing, because I know in sometimes where maybe the local economy or population cannot support a premium medical center.
Correct.
This is allowing people in those areas, whether it be urban or rural, to be able to get premium health care or premium guidance or advice or anything like that. How long have you all been doing the telemedicine program?
Well, through cardiology, we've been doing it probably 12 years. Right after I got here, we started looking at ways to help the local hospitals be able to keep patients there and not transfer unnecessarily. And now we're expanding those to work more into true consults at those hospitals through a platform in our partnership with HCA, as well as other opportunities to expand those services into respiratory therapy, electrocardiograms, other avenues that we can help, as well as our radiology services.
Yeah, so I just am blown away by that. And the fact that you all have been doing it for 12 years says a lot. But that's just amazing to me that you can have a doctor who's very experienced, who maybe would be normally inaccessible to the majority of someone in the United States or maybe around the world, but with this technology, you're able to provide that same care as if they were in the same room.
Right.
So that's truly remarkable. Very, very neat. What other things? Now, actually, let me back up a little bit because we focused a lot on cardiology, heart. It doesn't say that in the name.
No.
So I'm curious, are there any other focal or areas of focus that you all you all take care of?
So currently we have 3 surgical divisions, orthopedics, and we have 2 physicians there that specialize in spine or scoliosis surgery. We have 1 pediatric surgeon that does hip replacements for children, and quite often that is needed, unfortunately, for some children. We have pediatric urology for children that have kidney problems or bladder problems. And we also have pediatric ENT that does not only what you typical think of ENT as tubes and tonsils, but also airway problems or other structural components that connect the ears to the airway. In the medicine divisions, we have pulmonary, and we have the only regional accredited cystic fibrosis site. So we take care of very complex children with cystic fibrosis. We have a specialist with sleep medicine. Then we have a sleep center here that's dedicated specifically to children. We have gastroenterology. We have 1 physician who's triple boarded in rheumatology, allergy, and immunology, and he's one of the few rheumatologists in the state of Florida, which is very nice. We have nephrology, or kidney specialist, that works very closely with our urologist. And we have audiologists. So audiology actually works with ENT to help diagnose hearing disorders or other problems that might be testing needed in conjunction with the ENT service. So that helps from that. We do take care of cochlear implants. We take care of hearing loss. We do the screenings for that. And so that allows parents that are worried why their children are not advancing in their speech. And we will be starting soon a speech therapy program with one of our partners in Jacksonville to be able to deliver that by telemedicine because we don't have enough access here locally. And so that would allow the services that we have plenty of in Jacksonville, or they may not consider it plenty, but they are partnering with us to help it to the need here without having to transfer the provider. We can do it by telemedicine.
Gotcha. Well, that's a long list of services that you all provide. Very impressive. Children's specialty care has children's in the name, the word children's. What does that actually encompass? Are we talking about all the way till the day before you turn 18, or is there a cap on the age?
That is set by our board and the will that Alfred I. DuPont left, and so it is to 18, except in certain circumstances. In the majority of our practice in Florida, we can go up to 21 if they have been identified as a special needs child, or we can't find a provider willing to take them because of their congenital disease or chronic disease. A lot of adult providers don't feel they have the expertise to take that on. And then in congenital hearts, because that is also a very specialty need, we're able to work with our partners at Nemours Children's Hospital in Orlando to be able to take care of additional age range for children with complex heart disease. But we also do them before they're born, so that actually expands our time with our prenatal diagnosis.
All right. So that another added thing.
Another
that you
added,
all do.
correct. Yes.
Okay, you all have this new building, and your location is different, and some people may not even know this.
Right.
So let's talk about your new facility and your relationship with West Florida Hospital.
Yes, so we have a wonderful new partnership with West Florida Hospital, as HCA and West Florida has talked about connecting their hospitals across the Panhandle and the state. and expanding their women's and children's services. And so it's been a working relationship I have with the CEO, Carlton Ulmer, to help deliver on that. We've certainly identified that a single-story building for children with special needs, especially with wheelchairs and crutches, is a very good thing to have from our prior. And to concentrate the subspecialists so that we can do a team-based approach has been very good that we have learned to make happen here. So we have providers as well as patients that are able to go from one side to the other in a single day. It helps the parents, if they've taken off time for work, to come, get multiple appointments taken care of, all in without having to go up and down elevators or stairs. It's been a great thing for us. And we're right across the parking lot from West Florida, which has the pediatric ER, the inpatient services. They have wonderful operating rooms and procedure units, as well as they're coming close to completing their pediatric intensive care unit.
Yeah, that's not only is that convenient, but I would have never thought of a single level building being more conducive to being able to serve the children, and that totally makes sense.
Yeah.
I'm just real impressed with everything that you all are doing, that you're all providing. You have a great reputation in this area for providing that premium care to not only the children of our community, but apparently it spans out much further. And I'm actually curious about that. What's the farthest away that someone from Nemours Children's Specialty Care in Pensacola has provided care for through telemedicine?
Well, just yesterday I read an echocardiogram for a baby and a doctor in Gainesville, Florida, at the HCA facility, North Florida Regional there. So that's the farthest I did yesterday.
Yeah,
so.
That's just amazing that you're servicing people all over the state and potentially maybe the United States. I don't know how that works out.
I'm working on that.
Okay, all right, great. Well, I hope that works out for you. And, just with the track history that you all have had, I know that there's so many great things to come from you all.
Thank you.
So what is the best way for anyone who wants to find out more information about Nemours Children's Specialty Care, or if they want to bring their child in to be seen?
Well, they can certainly, their pediatrician can send in a referral if that's needed, or they can self-refer.
Okay.
They can certainly learn more about us by going to nemours.org and clicking on Pensacola, and that will list all the providers that we have and all the services that we have.
Okay.
If they, the parents can ask for an x-ray or an ultrasound to be done here, because we can guarantee that it will be read by a pediatric radiologist with that special expertise in children's care training, and that's also connected by telemedicine. And talk more to their provider too about the services that we've provided for over almost 20 years in this area.
Excellent. Well, thank you very much for taking some time with us today and telling us about all of the different things that you all offer, about your relationship with West Florida Hospital or your partnership with them. And is there anything else that you want to leave with our viewers?
Just that Nemours has been taking care of children for a very long time, and we're going to do that into the future and making sure the top-notch care is delivered right here at home.
All right, excellent. Well, no doubt that you all are going to be able to do that. Well, thank you again, Dr. Mehta, for your time, and just look forward to all the really cool and amazing things that you all are going to continue to do.
Thank you. We'll keep you informed.
Thank you very much. All right, everyone. Goodbye.